And this should be recorded now. Okay, so if anyone has any questions, feel free to ask them. I gotta figure out a way. All right, so let's get started. Healthcare in America. Healthcare is consistently rated by both Democrats, Republicans, independents, every single type, cross-section of people you can think about, as the most important issue in election polls. So on issues polls, if it's not the most important, it's the second most important. No matter your political ideology, you have a problem with healthcare in America. And to be honest, it is not hard to see why, okay? Healthcare in America is not, is not in a good place. Basically, what I'm going to talk about in this presentation is what the healthcare system is like now, so what we're living under with the Affordable Care Act, and what it might look like in the future. What plans are being proposed to revolutionize our healthcare system in the future. And these plans, I will give a disclaimer, are mostly Democratic liberal plans. I'm going to talk about the public option and Medicare for all, not because I want to be biased, but just because Republicans haven't given me a plan to analyze. There's just no Republican plan to fix our healthcare system at the moment. And that's just a fact. They tried to repeal Obamacare back in 2017, could not get it done because they did not repeal and replace. They were only repealing, right? So in this presentation, I'm going to be giving you the rundown on what exactly the future of healthcare could look like, largely under a more liberal administration. So let's get started. Right now, the United States operates under kind of a private insurance model when it comes to healthcare and health insurance. Generally, though, all sorts of health insurance have a couple core tenets, okay? First of all, we don't want people to die. We especially don't want them to die from not having insurance. And this benefits both the country at large and insurance providers, right? If people die and they do have insurance, it costs the insurance company more money because generally when people die, their treatments are more expensive. They have to stay at the ER for longer. So this costs insurance companies more money. That's why insurance companies would rather insure people who obviously aren't prone to major health conditions. So insurance companies really want to insure low-risk individuals, but also they want to make sure that people are using their insurance to get preventative care, like checkups, screenings, et cetera, so we can catch problems earlier instead of having to cost a lot at the ER later, right? Second of all, this is a governmental policy. We don't want people to be excluded from health insurance because they had the bad luck to get a disease. This is the motto of the pre-existing condition doctrine. Under Obamacare, health insurance providers cannot deny you insurance because you have a pre-existing condition. So if you have asthma or a previous heart condition, you can still buy insurance, right? And that's exactly what we want as a government perspective. We don't want people to be excluded from health insurance because they have a pre-existing condition. That's pretty logical. Third, though, is what I was touching on in the first part. We want people to be able to get preventative and routine care because this is just much cheaper than the going to the ER and, getting intubated and having a lot of treatments. We would rather you get the checkups, take the preventative measures with your insurance than costing insurance payers and your family a lot of money, right? And finally, this is more of, a liberal goal. We do want women to have access to women's health, including birth control. I don't like the way this is worded. Anant wrote this slide because the pill is way cheaper than the baby, and also we hate abortion. I really don't like the way this is worded, but basically studies have shown that when women have access to birth control, family planning, contraception, this not only boosts healthcare in general, it also boosts life expectancy and also has a correlation with the nation's GDP at large, right? Now, this isn't to say that that's causation, but there's definitely strong correlation with more women's autonomy and a better performing nation on all sorts of metrics, right? So these are some major goals of health insurance policy from a governmental standpoint. But, before we go on to the vocab, I kind of want to describe the goals from the insurer's perspective, because as far as private insurance companies go, their goal is solely to mainly just make money, right? They're filling a need in the market for health insurance and they want to make a profit. So that's why they're willing to not give health insurance to people with pre-existing conditions. If you have asthma, a lung condition, a heart condition, a disability, why do private insurance companies have an incentive to insure you? They don't, because you are at a much higher risk to cost them money down the road, right? They're going to have to pay the brunt of your expensive treatments down the road. That's why the Affordable Care Act and Obamacare was so revolutionary, because it forced these companies to offer insurance policies to people with pre-existing conditions. Now, insurance companies obviously don't want people to die either, so insurance companies would love if all of their customers were paying healthy 27-year-olds, right? They would love that. But alas, that can't happen, or else our system would collapse. And that's what our government policy is based upon, making sure, or at least trying to make sure, that as many people as possible are covered by health insurance. Now, a few vocab terms. Hopefully you can see all of these. I have the screen kind of messed up here, but first of all, premium. You're going to hear a lot in healthcare talk about people saying, my premium's too high. Man, Obamacare really screwed my premium up. My premium cost me too much, right? A premium is essentially just like your cost of health insurance. It's the amount you pay by month or by year to get insurance. So your Obamacare premium would be like the amount you're paying the insurance company like that month. It's like a subscription fee, right? Premium, pretty simple. What about a deductible? Let's say you have like a $1,500 deductible. A deductible essentially forces you to get some healthcare at full price before insurance actually kicks in. So like, if you're completely healthy throughout the year and you don't go to get a checkup or anything, or don't go to like the ER at all, you can theoretically just pay your premium and then not have to pay anything else, right? But like, if you need anything, if you need to refill a prescription, if you need to get like a physical done, a deductible is an amount you have to pay in full toward healthcare before insurance kicks in. So like what might have cost like $1,500 up front would only cost like $50 or $20 with insurance. But before the insurance actually kicks in, you would have to pay that $1,500 up front. That's just a mechanism to ensure that like people who are using insurance truly have already put enough money into the private, system. It's just a way to get you to pay money towards healthcare. Copays are like what I was saying before, like that $20 charge. You go to get a physical, insurance covers the brunt of it, but you get a copay. Copay is just a small amount you got to pay, even when your insurance does kick in. Provider network. So recently I had to go call my doctor to order me like a vaccine for college, right? And the first thing they asked me was make sure the vaccine you get is eligible for in-network coverage, right? In-network basically means that the insurance will cover the treatment from that network of providers, doctors, hospitals, et cetera, et cetera. And coverage is kind of the opposite. Provider network is like where you can get it. Coverage is what you can get. It's the services that your health insurance company will pay for. So some health insurance companies will give you will cover like all your physical and all your doctor needs, but might not cover vision and dental, right? Something like that. Access is your ability to get a medical service when you need it. So I might need vaccines for college, but what if I can't get them, right? This is especially a problem in kind of rural communities with not a lot of doctors, not a lot of hospitals, and not a lot of clinics. Access is a key term that exists in this sort of area, because when rural citizens don't have access to healthcare, we see scenes that seem straight out of like not a developed country, a developing country, where a Doctors with Borders-esque van rolls through and people living in the United States of America line up outside that van to try to get treatment, something that you would not expect to happen in these United States, but it does. And finally, the last vocab term that's important is a pre-existing condition that is simply a condition or disease that existed prior to you getting insurance. And once again, the ACA made it so that insurers cannot refuse you insurance because you have a pre-existing condition. So there are 3 ways to get health insurance, and this is where it gets kind of technical, okay? Basically, the first way, and the way that probably most of your parents get it, if you are well off, generally well off, upper middle class, the type of demographic that goes to national speech tournaments and has the resources to do that, most of the time, that universe gets healthcare through their employer, okay? Employee-sponsored health plan. This is where your company will just give you a health insurance plan. Employers typically pay the bulk of the premium, but may deduct some of it from the employee's paycheck. But obviously, you as employees would have to pay the deductible and the copay. Now, can anybody give me a reason why this might be problematic? Why is it kind of an issue to tie healthcare with your company? Does anyone have an idea? Yeah, so Udit says in the chat, job lock, and Gaia says those who are unemployed won't have access. If you're unemployed. Right. So the unemployed issue is different, and I will touch on it. But what I was looking for really was what Udit is saying, job lock, okay? It makes it very hard to search for a new job or to leave your job. If you don't like your job and you leave it, health plans are another thing you have to consider. And that's something that in my mind and in your mind might be crazy. Like, wow, I really have to consider not only if this job is right for me, but whether it offers healthcare. Like, that seems really, really suspect and really, really weird, right? And that's a big criticism of an employee-sponsored health plan, that it literally locks you in your job because you literally can't find healthcare elsewhere. In fact, Andrew Yang, when he told his wife he was running for president, the first words out of her mouth were, what are we going to do about healthcare, right? It's a predicament that having an employee-sponsored health plan puts you at risk for. Now let's talk about those unemployed people, right? So let's say you're in between jobs or like unemployed in general, and you're low income. What happens? Well, if you're unemployed, there are really 2 other ways, or even if you are employed but your employers don't give you health insurance, there are 2 other ways you're going to get your insurance. First of all, government entitled programs, right? So if you're super low income or you have a disability that qualifies you for insurance, you get Medicaid. Medicaid is controversial, okay, because it essentially gives poor people, disabled people, health insurance. And this is controversial because the states are allowed to decide how expansive they want Medicaid to be. States get to decide whether they want to expand Medicaid or not. And look, when the state decides and not the federal government decides what extent Medicaid is used, you have a lot of difference in the efficacy, the wide-ranging effects, and the amount of low-income health insurance available between red and blue states. That's just a fact, right? Or whether the state has the budget for it or not. So Medicaid has a lot of issues. The states vote on the expansion, and generally, it's far, far more controversial than Medicare, okay? Medicare is basically if you're over 65 and you're retired, you just get Medicare. It's a great plan. You get on the government's dime. It's free healthcare, much more popular. No one would dare to touch it or defund it, at least for the time being. We might see in a couple of years. And since it's so popular, it's been used as a marketing tool for like Medicare for All, even though Medicare for All isn't actually Medicare for All. It's been used as a marketing tool in that regard. Medicaid, on the other hand, is just far more controversial and less popular, right? But it's still there. So if you're low income or disabled, unemployed, can't find a job, you might qualify for Medicaid. Otherwise, if you're over 65, you get Medicare. And the third and final and most controversial overall way to get health insurance was kind of revolutionized, introduced by the Affordable Care Act, and those are through the private market. And through the ACA, those are generally through state markets, okay? So basically, there's an exchange. There's a healthcare exchange. The point of the ACA is that, like, health insurance companies would put their plans in competition with each other in each state, basically. So you would have state healthcare exchanges where you could compare plans from providers and choose the one that you think was best. So the one that was cheapest maybe, or the one that offered you the most benefits, et cetera, et cetera, et cetera. So individuals would actually buy the insurance on healthcare.gov, the exchange, which was kind of controversial because healthcare.gov had a ton of glitches during the rollout. But that's basically what happened, okay? So in this method, right, individuals are purchasing the health insurance, so they would pay the premium, they would pay the deductibles, they pay the co-pays, but there might be some government subsidies to help. So what are some problems with having a state-based healthcare exchange for insurance? Does anyone have any ideas? What are some problems with having a state-based exchange? Or just a private exchange in general? Does anyone have any ideas? Okay, so a big issue was that, like, for example, the health insurance companies in the market in a state like Wyoming were much different from a health insurance company on the market in a state like New York, right? In some small states, it just wasn't profitable enough for multiple companies to be offering low rates. So kind of created a natural monopoly where there was only one healthcare provider or one health insurance provider in these small states. Therefore, with no competition, they could really set the prices up high. That was a failure of the exchange. So it really hurt depending on what state you lived in. So let's talk about Obamacare in more detail, okay? First of all, probably the most popular change, no one is going to touch this. People can stay on their parents' insurance until the age of 26. So Obamacare passed in like late 2009 or early 2010, can't really remember, but it really started kicking in 2014. They can stay on their parents' insurance until the age of 26. That's really, really crucial because even critics use this. I mean, look, Tomi Lahren, if you don't know who she is, conservative commentator on Fox News, she was bashing Obamacare one day, and then a guest on the show said, "Where do you get your insurance?" And then she said she's still on her parents' insurance. So Obamacare kept her on her insurance and will keep, me, you maybe, on your parents' insurance until the age of 26. It also expanded Medicare. That was something that a lot of people liked and is likely going to be a part of the next healthcare plan that comes as well. Third, and most important for this, insurance companies cannot deny you access to care for a pre-existing condition. Now, one of the most fundamental rights of our U.S. healthcare market that people would really like literally riot if this was taken away. This fourth one is super duper controversial, the individual mandate, okay? So that was the big part of Obamacare, the individual mandate, meaning that everybody should buy health insurance or else you receive a penalty, okay? So what does that mean? That means that if you don't get healthcare through your employer and you don't qualify for health insurance through Medicaid or Medicare, you really essentially just needed to buy insurance through the private market, right? And there's a good bit of logic behind that, okay? The individual mandate basically stipulates that if everybody has to buy from the market, it naturally drives prices down. That's the logic, right? Since everyone's required to buy it, and healthier people will be required to buy it. Like, for example, some 27-year-olds beforehand just wouldn't buy health insurance because they thought they were healthy and didn't need it. So that could cause like the insurance companies to raise their prices a bit higher. because everyone else who was buying it was just unhealthier in general. But now that everyone has to buy health insurance, the logic was that it would drive down premiums and make healthcare more accessible and cheaper to everyone, while giving health insurance companies an incentive to offer plans for different types of customers, right? Now, here's a problem with the individual mandate. People did not like it, right? Republicans were up in arms about it. Legal challenges in courts are centered around this individual mandate. And largely, I think just last week, the Supreme Court or a big court, let me search this up really quick. Really late last year, a court just struck down the individual mandate law, right? They said that an individual mandate was just unconstitutional. It said that since the individual mandate was unconstitutional and that was like and that there was a penalty for not buying insurance would have to be set to zero, okay? So in December, a federal court said that the individual mandate was unconstitutional and that the penalty for not buying insurance would be reduced to $0. Now, this hasn't gone through yet because the Supreme Court still has to hear this. It's being appealed, okay? But that's what the federal court's rationale was. And they argued that since there was no penalty for not buying health insurance, it no longer falls under Obamacare's jurisdiction to like tax the people. And therefore, since the individual mandate was the integral part of Obamacare, the entirety of Obamacare is also unconstitutional. So if the Supreme Court rules that that's true, would have drastic consequences, right? So we'll see how that case plays out. But once again, let's move on, because even past this controversial individual mandate, there's still more things to cover about the ACA. Companies must spend at least 80% of premiums on providing actual medical services. If they spent it on advertising or executive salaries, they have to pay the excess back to policyholders. So this is just combating like quasi-corruption and stuff like that within the healthcare industry. And then finally, wellness and pregnancy exams are now free, and that includes co-payments. That's cool. Big win for women's health. But there's a SCOTUS case on the contraceptive mandate. The contraceptive mandate was that like employers would have to like cover healthcare plans, including birth control and contraceptives for women. However, just last week, just 7 days ago, the Supreme Court ruled that any employer with like an objection against this law, so like a religious objection or a moral objection, can now decide to not cover contraceptives. So this was a big setback for women's rights activists and progressive healthcare activists, but SCOTUS repealed this part of the contraceptive mandate, which was very, very controversial. So that's the gist of the Affordable Care Act, okay? Let's run over some stats. Let's go over first, what was life like before the Affordable Care Act, okay? What percentage of Americans were uninsured before 2010? Anyone want to give me a guess? Just in the chat or something. $75. I think that is a bit high. I think it's 16%, okay? So basically 16% of Americans were not insured before 2010. Keep in mind, if that seems low, it's because like the vast majority of like white collar workers in America get their health insurance from their employers, right? And the vast majority, a big portion are also eligible for Medicaid and Medicare. But 16% was a big number because like you just have 48 million people running around without health insurance. That's a big drain. That's a terrible system, okay? Now, how many Americans were uninsured in 2016 after Obamacare? You can give me a percent, maybe numbers, any guesses, any thoughts? What do you think Obamacare did to the number of Americans uninsured? 9%. That's very close. I think it's 8.8%, right? So essentially, Obamacare cut the number of uninsured Americans in half, basically. And that's really good, largely because of the parental rule where kids can now stay under their parents' health insurance until 26, and obviously the establishment of these private healthcare exchanges and the subsequent individual mandate that forced people to buy health insurance even if they thought they didn't need it, right? So that's super, super interesting. And obviously, it's arguable, debatable, but largely accepted that having more people on health insurance and obviously having more people insured is a good idea. However, 8.8% uninsured is not even close to 0% uninsured. The goal of the Affordable Care Act was to get universal health coverage, and that did not happen. And the United States still remains the only developed country in the world rather, without universal health care. So since Trump has took office, though, his administration has actually made a tax on the Affordable Care Act. I mean, that's pretty self-explanatory. He does not like policies pushed by Barack Obama. They tried to repeal it back in 2017. The policy was saved by the grace of a single no vote by John McCain. And yeah, there is just very, very sustained attacks on the Affordable Care Act from the Trump administration ever since 2017. And that has led to 700,000 people losing their health insurance or becoming uninsured when they were insured from when Trump took office till now. And this source is not the most recent, so I'm sure it's more by now. Especially considering the fact that people are now unemployed due to the COVID crisis. And since, once again, bafflingly, healthcare is still inextricably tied to employment in this country, more and more people are facing the threat of no health insurance in a crisis that seems to dictate that you should have health insurance, right? It's absolutely ridiculous, but it is what it is. And we are seeing the flaws of our healthcare system play out in full effect right now. Well, why can't we just choose not to have insurance, right? This is the argument against the individual mandate. Why does the individual mandate matter? I'm healthy. I don't think I need insurance. Why do we have to have it? Well, the answer to that really is that emergency rooms have to treat patients no matter if they have insurance or not, right? So think about it. If you don't have insurance and you're this 27-year-old, you think you're super healthy, but you're not healthy, right? You suddenly have a catastrophic accident, like a brain aneurysm, heart attack, stroke, out of nowhere that you had no idea you had. What does that mean? That happens like more often than you might think. And you have to go to the ER, and the ER has to treat you. Or let's just say you like break a bone, right? You like break a bone, and you literally can't rehabilitate the bone at home. You need like PT, you need to go to the emergency room to get them to fix it up. So boom, right there, the ER has to treat you because like they're obligated to. It's the code. But if you don't have insurance, health bills in this country are outrageous. You're going to have to pay that in full. And let's just say not many people have the money to pay for like a 2-night, 3-night, 4-night stay in the ER after you're recovering from a catastrophic incident, right? So if that's what happens, you will go bankrupt and you will go in debt. But it also hurts the ER because they're treating you and you're not paying them. Insurance isn't paying them. So how much money did emergency rooms lose in 2013 due to uninsured patients? $50 billion, right? That is why insurance is so important. Even if you think you don't need insurance, you might, right? So therefore, insurance is important for not only keeping your own healthcare costs down, but also making sure ERs, hospitals, doctors don't lose too much money. This slide is just going over what I was saying, right? ER is legally required to treat everyone, regardless of whether they can pay. And this also speaks to like behavioral tendencies. People with no insurance actually wait until their condition is an emergency. So let's say you have like a recurring headache, and you're like, shoot, I don't know what this is, but I don't have insurance. I can't get it checked, blah, 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 blah. And boom, finally, it turns out that you've had like a brain tumor in your brain, and now it's spread, and now you have cancer. Like, come on. Now, if you had gotten this checked earlier, it might have been fine. But since you didn't and waited until it was too late to seek treatment, you're going to have to get the most expensive treatment, right? And that costs you money, costs the insurance, costs the ER money, costs the hospital money. And just random use of the ER for non-emergency conditions also leads to excessively high medical bills and overcrowding. So how many people have pre-existing conditions in the United States? Why does this necessarily matter for healthcare? This is largely because these people now have to be given health insurance. 52 million people. That is between 1/6 and 1/7 of the US population have some form of pre-existing condition. And before the Affordable Care Act, if you weren't on your employee-sponsored health plan and you weren't on your Medicare or Medicaid, and you were on the private market and you wanted to buy health insurance, they could just deny you because you had a pre-existing condition. That's not good, right? We want to protect that 1/6 to 1/7 population of the United States and offer them a way to get health insurance. So let's talk about why this matters and why the individual mandate is necessary to keep the pre-existing conditions people insured. First, customers with pre-existing conditions are the most costly to insure. So before the Affordable Care Act, policies just deny them coverage, right? They don't want to lose money. But look, if the Affordable Care Act simply said, just outlawed discrimination against people with pre-existing conditions, the marketplace would have incentivized the worst possible behavior, right? So let's say you have a pre-existing condition, okay? And health insurance companies are just forced to give everyone insurance without an individual mandate, just without an individual mandate. So let's say you have a pre-existing condition, don't buy insurance, but like insurance companies still have to insure you if you go buy it, okay? Then you could theoretically just wait until your condition got like bad enough and then just buy insurance. It would be outlawed to discriminate against you without an individual mandate. And then boom, it would just incentivize bad behavior and it would cost the insurance companies a lot of money. So if they outlawed that, but let the people choose like if they wanted to buy health insurance or not, it would have just been a problem where the timing of when you bought health insurance would have cost people money, okay? This would have obviously caused insurance costs to skyrocket because only the sickest people would actually be insured. So the way the ACA fixed it was to pass an individual mandate requiring everyone to have insurance. And it's debatable whether or not that was effective, whether that worked, blah, 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 blah. But it did happen. And with the individual mandate came a penalty. Obviously, if you did not buy health insurance under the individual mandate, you would have what I think is a yearly penalty of $695, okay? So obviously you can make the decision and say, I would rather pay the penalty than buy insurance under the individual mandate, and that would be your prerogative. But once again, late last year, and the Supreme Court is gonna hear later this year, a federal court ruled that this penalty would be reduced to $0. Which means the individual mandate's useless, right? It would essentially be useless. And with the individual mandate being useless, you can make the argument that Obamacare is useless and the law cannot exist as it stands. But the jury's still out. The Supreme Court still hasn't decided, so we'll see. Now, here's some more problems with our current insurance system. Underinsurance. So underinsurance is when your insurance just doesn't cover enough or doesn't cover stuff to the extent you want it to. When a person has health insurance, but healthcare costs still consume more than 10% of their annual income. To remedy this problem, the ACA requires all insurance policies to cover 10 essential benefits, including reproductive health care. Once again, this was recently attacked. Emergency care and mental health care. Our mental health care problem is still very undercovered in the United States, however. How many people are considered underinsured under the ACA? So remember, in 2016, 8.8% of people were uninsured. How many people were underinsured? Around 30 million. So really, around 1/5 to 1/6 of our American population is either uninsured or underinsured, right? So that's concerning, largely because it's just that many people to which healthcare costs are still just a big problem. And you can understand just why it's such a contentious election issue year after year after year. And the average deductible for an individual health insurance plan as well. Before insurance even kicks in, you're going to have to pay $1,500 in an average deductible. So once again, that just eats up at your healthcare costs. Even if you're relatively healthy, you just go in for something, you're going to have to pay in full $1,500 before it starts kicking in. And for a family, it's even worse. Average deductible for family insurance plans, $2,500, right? So they're just high deductibles that still eat into people's incomes, along with premiums and copays. Healthcare, even with insurance, can be very expensive. That's the point. And a healthy family of four can expect to spend 11% of their income on healthcare costs. And especially when you consider the fact that more and more activists and more politicians are saying that healthcare is a human right, spending 1/10 of your money on healthcare costs does not seem very human rights-ish, right? So that's what everyone's arguing about. It's why even with the ACA, there's still so much contention around the healthcare policy. And the ACA failed, I touched on this before, largely because the state marketplaces still weren't efficient. So the state exchange was a governmental regulated health insurance marketplace. The kicker is that insurance companies get to choose whether to participate, right? They get access to customers and price stabilization subsidies in the state exchange, but they also experience more state regulation. And of course, as I was saying before, the goal was for customers to shop for insurance by comparing which plan they wanted in that state exchange to incentivize competition. However, though, what actually happened was that insurance companies had to agree to a complex set of regulations that a lot of them didn't like. And in large states, the cost of complying with those regulations was offset by the large customer base. So some insurance companies literally just decided, we don't want to follow the rules on this state exchange. We can still offer health insurance to other customers and just, get those people to buy our health insurance without going through this burdensome process of getting on the state exchange, right? So that's what happened in large states. And in small states, competition was bad for the insurance companies. Not everyone could make a profit, so they just left, leaving many states with only one insurance company. And when you only have one insurance company, they can really do whatever they want. They just jacked up the prices, and nobody could afford it, right? So that's why the ACA state exchange idea had major obstacles. So that's the state of our current healthcare system. Let's take a short Q&A session now, just a short intermission before I spend the last part of this talking about the future of U.S. healthcare. Does anyone have any questions about our current healthcare system and why people don't like it?
So, aren't there, you said that the average cost was 11% of their total income for a family.
Mm-hmm.
Aren't there like discount cards like GoodRx that offset the costs to when it comes to specifically that deficit spending, you have to spend like the 2,500 for a family?
Maybe I don't know much about those cards per se, but that's a possibility. But I would like to think that money has to come from somewhere. Would you say it was GoodRx?
Yeah, yeah.
Um, oh, that's mostly medication discounts, right? So that's
Yeah.
not. Yeah, okay. Yes, you do also have to pay deductibles for like pharmaceutical increases, and drug prices in general are very high. And this is a pretty recent startup. So, um, I I I haven't heard of this personally. Um, but this makes sense that people would try to get discounts on drug pricing as well. And I will go over why drugs are so expensive in the United States and why prescription medicine has such an exorbitant cost. But yeah, deductibles I'm not like it might avoid the deductible, but the deductible is still there. You would still have to pay it, I think, like for another procedure or treatment.
Hmm.
Any more questions? Yes, let's see. What is the Republican Party's justification for trying to repeal Obamacare? That's a good question. The question is that, bluntly, they don't like Obama. That's bluntly, I mean, Obamacare is a Republican plan, first proposed by Mitt Romney in Massachusetts. Mitt Romney, who literally ran against Obama in 2012, saying that he would repeal Obamacare, had basically the same plan in Massachusetts. It's literally Romneycare with a few tweaks. They don't like Obamacare because Obama made it. That's just the crux of the issue. They can tell you whatever they want. Most of the complaints from Republicans about Obamacare fall under a few categories. A, they don't know the difference between Obamacare and the Affordable Care Act. They're actually the same thing, but people hate Obamacare but love the Affordable Care Act. They're literally the same thing. Second, they don't like how Obamacare was passed. Obamacare was passed in 2010 um, on a partisan line vote. Only Democrats voted for it. Okay, so they don't like how it was passed, but it's not really criticism of the policy. And third, some people think it goes like too far. They don't like the individual mandate. They want choice, which I think is just a misguided way of dealing with healthcare in general. All right. So even with Obamacare, U.S. healthcare is still messed. What's the future? So there's two big options, all right, especially prominent in this year's Democratic primary, either Medicare for all or the public option. You're going to hear a ton of buzz about Medicare for all, okay? Medicare for all, Medicare for all, Medicare for all, blah, blah, blah. So what is Medicare for all? Medicare for all essentially is not like Medicare for all. It wouldn't take the Medicare plan we have now and give it to everyone. That's not what it means. It's essentially single payer healthcare. It's a single payer plan in which the government would cover all healthcare costs. This means that you would just walk into a hospital, walk into an ER, walk into a doctor's office, get treatment, and receive no bill. All healthcare costs would be covered. This goes past Medicare, covers dental, vision, everything. You need something, you get it. You need drugs, you get it. Government pays for it. And this largely eliminates the private insurance industry, right? What does private insurance have to offer in a world where the government pays for everything? Nothing, 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 nothing. It can still exist in some form by offering like way more advanced treatments, like for example in the UK, but largely the vast majority of the private insurance industry gone. So who are proponents? Bernie Sanders, Elizabeth Warren, AOC, other progressive Democrats. And this is truly a radical, radical, radical change. Okay? This goes so far past the crux of our healthcare system. And it's very, very controversial. So controversial that even candidates who backed this early on, like Kamala Harris, for example, backed this early on. Elizabeth Warren was a big backer. They backtracked or compromised. Elizabeth Warren kind of said that they wanted a public option first before transitioning, right? Bernie and AOC are still ones that just want to go from the start, eliminate everything. So that's the rundown on Medicare for all. What's the big issue? The big issue is that estimated by the Urban Institute, it would cost 34 trillion US dollars over 10 years. Now, to put that into perspective, $34 trillion is basically the same cost as all other entitlement programs right now. So Social Security, food stamps, every single other entitlement program together makes up around $34 trillion in government spending over 10 years. So that means more taxes for somebody. And Bernie, Warren, AOC say that most of the time these taxes would come from the rich. But I will touch on that later, okay? But this number, very, very big. But, I mean, come on. Bernie and Warren always say that Medicare for All saves money, right? It saves money because, come on, guys, look, American families are paying way too much for health insurance right now. You know, they're just paying too much. Sure, it might raise taxes, but like they'd be saving overall. Because let's say you're paying like $2,000 for healthcare as an individual now, just because of your deductible and your copays and your premiums, right? So if you're paying $2,000 now, under Medicare for All, you might be paying like $1,500 in taxes, but you would be paying nothing for health insurance or anything. So you would ultimately save $500. Bernie and Warren make the case that it would save money across the board. So is this true? Well, yes, but actually no, okay? There are studies that say, yes, overall, Medicare for All saves money. These studies are questionable at best, flawed at worst, if we look at how we can possibly get there. But let's talk about these studies first of all, okay? Basically, like, there were multiple studies like by the Mercer Institute and even by some conservative groups that found that Medicare for All would actually save like the health industry in general money. It would cost less for Americans to get healthcare. But it made some assumptions. Those studies assumed that Medicare for All would run without like regulatory waste or like a lot of red tape or like it would be a smooth transition. That's not true. There's definitely going to be obstacles that would cost money. So that's the first part. The second assumption, however, was that Medicare for All would compensate healthcare providers, ERs, and doctors under the Medicare rate, okay? And if you don't know what that means, essentially, they were making the assumption that they would pay the people who actually give you healthcare the same amount as they pay them under Medicare. And under Medicare, doctors, healthcare providers, ERs, hospitals get paid less, okay? Because Medicare, like, generally pays healthcare providers at a lower rate than private insurance companies, sometimes up to 40% less. So if a doctor offers you, who is on your private insurance, the same treatment as someone as they offer someone on Medicare, they get paid less from the Medicare person, okay? That's just how it works. That's just how the negotiating works. In order for this to save money, they're assuming that Medicare for All would pay doctors and healthcare providers under the Medicare rate. So essentially giving a 40% cut across the board to revenue from hospitals, ERs, doctors, etc. Now, not many Asian parents are going to want their kids to go become a doctor if they're not getting paid the big bucks. But Medicare for All really, under that assumption, only saves money if you cut doctor pay drastically, if you cut hospital revenue drastically. And that's what people are really saying when they make the case that Medicare for All would put hospitals out of business, because it really might, okay? It actually might. Now, we could argue, let's not pay them less. Let's still compensate them fairly, et cetera, et cetera. That would mean it costing even more than 34 trillion, right? So that's something we have to consider. But let's talk about how we can possibly get to that $34 trillion number in the first place. Once again, I already ran over this. This is about the same as they currently spend on all entitlements. One big plan is Elizabeth Warren proposing a wealth tax on the 2 cents out of every dollar for over 100 million. You know, you've heard that phrase 100 times. Well, that wealth tax would only generate 2.75 trillion over the next 10 years. Repealing Trump's tax cuts would raise an additional 2 trillion over the next 10 years. So financially, we're just nowhere near. And we would have to find cuts somewhere in the budget, maybe military, and we would definitely have to raise revenue. So that just means raising taxes somewhere. Remember, raising taxes under proposed wealth tax would only raise 2.75 trillion over the next 10 years. So The money's got to come from somewhere. We could argue it comes from the Pentagon. We could argue it comes from middle-class families, but it has to come from somewhere. And paying for it is a big sticking point that no one's figured out really how to do yet. And politically, it would really have to pass a House and Senate that, even if Democratic controlled, is filled with center-left politicians, Amy Klobuchar, Chuck Schumer, etc. They're non-starters, and Republicans for sure are non-starters. To them, Medicare for All is the gleaming beacon of socialism in America. There's no way a single Republican ever votes for Medicare for All in the near future. So, Medicare for All, is it feasible at this moment? I would say even if Bernie was president, probably not. But now that Joe's the nominee, definitely not. No chance, okay? But there is a way that we get there in the future, and that would be the glide path. Very, very eloquently named the glide path. We're gliding from a public option to Medicare for All. And that's where a public option comes in, okay? What's a public option? Well, a public option is kind of an extension of Obamacare in the insurance markets. It's a plan in which private insurance would still exist, but would face competition from a government-run plan. So basically, in those state insurance boards, the state insurance exchanges, there would still be an exchange, but on the exchange, next to all the private plans, there would also be a public plan. So you would be able to choose between like Blue Cross Blue Shield, Aetna, and then the U.S. government. And then the U.S. government public option would also be an option. This was first proposed and pushed in 2009, but did not pass by one single vote, Joe Lieberman. So we could have had this a decade ago. We literally could have had a public option. But now it's resurfaced in the debate, favored by Joe Biden, Pete Buttigieg, and Elizabeth Warren. The latter two have actually suggested that this could glide into Medicare for All. Why? Well, it's pretty simple to imagine. Think about it. If you put all the public options onto the marketplace and people start realizing like, holy moly, the government plan is actually just cheaper than the private insurance plan, then there's no reason to buy the private insurance plan unless they become even cheaper. So as more and more people get onto the government plan, like more and more confidence is built into a government-ran health insurance, and then eventually it could glide on to where like so many people have this government plan that you could just pass legislation making Medicare for All, and it would pass much easier, right? So that's a suggested glide path. And there are like variations of this plan, like some like Pete Buttigieg and Beto O'Rourke's plan would have automatically enrolled uninsured people in it. So there are a ton of different like variations on this public option plan, but the gist of it is similar across the board. Private insurance still exists, but would face competition from a government-run plan. So if you can imagine, both Medicare for All and the public option, even though they're very, very different, private insurance companies hate both of them. They hate Medicare for All more, obviously, because it completely just wipes them out of existence. But they don't like the public option either because it means they have to face competition. But the big thing about the public option is that it's way cheaper than Medicare for All, right? So the details. Pete Buttigieg's Medicare for All, who won it, would only cost $1.5 trillion over the next decade. Biden's plan would cost around $2.25 trillion. Biden would add a public option while also increasing the marketplace subsidies for the ACA, which would help low-income families who aren't eligible for Medicaid pay for health care. And many public option plans would also lower the age of Medicare eligibility. So Biden's proposed it to be lowered to 60. So overall, this is a sweeping expansion of healthcare and also an introduction of a new option for healthcare for consumers to buy, right? This is inconclusive on whether this leads to overall savings, once again, because hospital and doctors are just paid less under Medicare rates. But as I said, public option and Medicare for All are seen as existential threats by the health insurance industry. And in theory, if the publicly run marketplaces are more effective, it naturally transitions into a single payer system, a glide path per se. So those are the main two things about the future of American healthcare from a liberal perspective. But another final issue that we have to tackle or discuss is drug prices. Once again, we hear all the time that American drug prices are too high, prescription drugs are too expensive, and there's a reason for that, okay? why are drugs in the US so expensive? The traditional take is that the US pharma companies need to charge high costs to continue innovating. The US pharma industry produces and innovates some of the most cutting edge best drugs out there. This is indisputable. R&D in US pharma companies is one of the best in the world, if not just the best in the world, right? However, this rhetoric for justifying high prices is flawed. Many recent price increases are from drugs already on the market. And furthermore, when R&D happens, big pharma in the US often socializes the risk while privatizing profits. They get funding for science and research and development from taxpayers, from the government, but they take all the profits, right? So the take that they need money to continue researching and developing, not necessarily the greatest take. The big issue really is that in other countries, before a drug hits the market, the government negotiates the price so they can drive it lower. The US is the only developed country that does not negotiate drug prices with pharma companies before they hit the market, which is crazy. So how would we lower prescription drug prices? It's pretty simple. A public option and a Medicare for All plan would have the government play a role in negotiating new drug prices. That's pretty simple. It would also open up the market for US consumers to import foreign drugs. Okay? So sometimes if a drug is cheaper in Canada than it is in the US, we would be able to import it. And finally, a more long-term solution. A lot of these existing drugs are getting price increases because the companies still have patents on them. So no one can make a generic. But if we can reform patents so more generics can get onto the market, that's a more long-term solution. So here's the bottom line, okay? America is the only developed nation without universal healthcare. Now, I'm not talking about single-payer healthcare. It's just like not everyone is covered in America, and everyone is covered everywhere else, okay? Developed nations. And you'll hear the thing like from liberals, you'll hear like, or from leftists really, you'll hear like, oh my God, Bernie is only left wing in the United States. If he was in Europe or anywhere else, he would really just be left of center, blah, 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 blah. Let me be clear. Medicare for all is radical, no matter which country you're in or no matter which way you slice it, okay? Eliminating all private health insurance under a single payer system is very rare worldwide. Most countries have some version of a public option where you're just enrolled in a government plan if you don't have health insurance. So there are a few countries, however, that do follow a single payer model, really. The NHS in the UK, socialized. Private insurance does exist though, but it provides like minor perks, like faster waiting times and really, really rare treatments for really rare diseases, okay? Germany has a two-tier system with both public and private healthcare. So public healthcare was free for everyone, would cover like the lower tier of treatments, and private would go above. The US, that's like more of like a vertical division, right? You have a tier on the top, a tier on the bottom. What the US public option is proposing is kind of a horizontal divide. You got a private plan, a government plan that should theoretically do the same thing, but they would be differing in like cost and stuff like that, right? There are far more nations with a blend of the two, public and private health insurance, than true single payer. Canada and South Korea, along with the UK, would be examples of like more true single payer systems. So that about wraps up this presentation. Does anyone have any questions about anything I touched on? Okay, if not, you guys can head to the main room or head out of the Zoom. It's lunchtime. Just be back by 1 p.m. Central. Cool.